Urinary incontinence is the involuntary loss of urine. Over 50% of females experience UI at some point in their life, and 15 to 25% of hospital patients use a urinary catheter. A common solution for UI in hospitals is an indwelling catheter. However, the risks of infection are high and they predominantly affect female patients. The PureWick is an external catheter that is placed in between the patient's labia and relies on suction to remove urine and stay in place. However, the FDA MOD database contains over 1,000 reports pertaining to pressure injuries, skin dermatitis, and infection. Thus, we aim to create a device that collects voided urine externally in female ICU patients experiencing urinary incontinence that minimizes discomfort, infection, and injury.
Our prototype has a curved face to properly sit on the pelvic bone. There is a wide rim around the basin to make it more comfortable, and also 3 outlets for improved urine flow out of the device so that urine is suctioned away no matter the patient's position. There is a ramp where the device makes contact with the perineum to prevent fecal contamination. The 3 tubes that converge into one connection point at the top of the device efficiently collects all voided urine, prevents leakage during use, and limits suction at the skin surface. This component is sewn together, composed of a polypropylene rim to prevent urine leakage, an elastic mesh that facilitates regular leg movement, and a hydrocolloid adhesive for comfortable attachment to the inner thigh. While this iteration is 3D printed with TPU, our final product would be manufactured with medical-grade silicone.
By following our instructions for use, device placement is easy to complete. First, unlock the rim from the basin and slide the fabric component in. Snap the rim down to lock it in place. Clean the patient labia and peel off the adhesive paper and position the device on the patient with the tube pointing upwards. After attaching the adhesive to the patient's inner thigh, the device is now ready to be used. If fecal contamination occurs, the fabric component can be replaced and the basin can be disinfected using sanitizing wipes. The basin should be replaced every 24 hours.
Here's a demonstration with a peristaltic pump simulating urine flow.
Our team conducted an IRB-approved formal usability study. Participants who are registered nurses start by placing both our device and the PureWick on a manikin following standard ICU procedures. So far, 75% of them have placed MOUSI in the correct position over the outer labia and urethral opening. Our survey reported that all participants agree that our device would remain in place more effectively than the PureWick. Patient comfort, ICU integration, and overall device satisfaction were roughly equal between the 2 devices. All participants preferred the shape of our device to the PureWick and shared similar feedback on device setup, providing improvements for manufacturing.
Our team is excited to continue developing innovative technology in women's healthcare, and we thank you for listening.